Anna, okay.
Okay.
Let's start.
Hi, everyone. Thank you. Hi, everyone. Thank you so much for inviting me. This is a great initiative. And I didn't bring any slides, but I will try to answer the questions. And now I work in a pediatric emergency department near Porto, here in Portugal. And the workflows and the definitions are always changing, as in the rest of the world. So I will say and explain how the things are working now. Can you hear me? Yeah? Are you hearing me?
Yeah.
Yeah.
Yes, no problem.
So the first question about the organization of the pediatric emergency department. So here, in relation to the organization of the space, and I will talk also about the organization of the human resources. So talking about the organization of the space of the pediatric department. So we have restructured the pediatric department into two different areas, one for the suspect cases and the other one for the non-suspected cases. And about the human resources, we are still using the same number of physicians here in my hospital. Usually we are 4 pediatricians working during the day and 4 pediatricians working during the night. We usually do shifts of 12 hours. And the rest of our pediatric service has been helping us here in the emergency department. So as the out clinics is closed now from the beginning of March, we are all organized into in the emergency department. So usually we are 4, and usually 2 or 3 of us see the patients who are suspect from COVID infection, and generally one of us sees the other patients. We usually have 3 nurses, one for triage, one that stays with the suspect cases, and another nurse that usually treats the other patients. So about the second question, the definition of suspect case of coronavirus. So in my hospital and in the Portuguese hospitals, we suspect of a COVID infection patient if he or she has fever or cough or short of breath. Any of these characteristics makes us to ask for the test. About the third question, how do we manage suspect COVID patient in the ER? So after triage, the nurse tells us if it is a suspect case or not. And if it is a suspect case, he will follow the specific path. So if he will wait in a waiting room where there are just the suspect cases until the pediatrician calls that child. The pediatrician puts on the right PPE and then asks for the child and sees the child in one of 2 rooms that we have specific for that. After the pediatrician sees the child who we suspect, it will be asked for the test that will be collected by the nurse in another room. So after that, if the child is stable, if it's ready to go home, the child will be given the prescription and will go home with some information about the COVID disease and about how to get the result of the test. Usually we have the result of the test after 24 hours. If the child needs to be admitted, he will go to another room, and in that room he will get the treatment that the child needs or the exam that the child needs. And if the child, after we have received the test, and if it is positive, and if the child needs to be admitted, then if it is a COVID patient, he will be transferred to another hospital. Here in Porto, we have one hospital that receives children COVID positive that need to be admitted. And this is how we usually manage our suspect cases. So the criteria to define a coronavirus infected patient. We define a coronavirus infected patient if he tests positive for SARS-CoV-2. We use real-time PCR for SARS-CoV-2. The fifth question about if we have paths for healthy, for suspected, and for infected patient. Yes, as I talked before, we have two different paths for suspected and for non-suspected patients. And about infected patients, as I told before, the infected patients that have a mild disease, if we just need to give her an asymptomatic treatment, stays in a specific room. But if the child needs to get any specific treatment, he has a severe disease, it has to be transferred to another hospital. About screening parents, until now, we do not have a program for screening parents, but we are trying to. And because every child that we admit COVID negative, we will try to screen the parents too and wait for the results until he goes to ward. And about the last question about clinical pictures we have found in children with coronavirus until now, in my hospital, we had around 20 coronavirus positive from the beginning of March. And the patients I've seen, the patients we have seen are not very different from every other viral respiratory diseases that usually are not severe. So until now, they are not very different from any respiratory disease or gastroenteritis, viral gastroenteritis, not very different from that. And until now, we had around 20 positive cases. And in Portugal, we had until now less than 1,000 cases in children, and no deaths until now. And I think I have already answered all the questions. Thank you.
Thank you to you, Anna. Io penso che abbiamo il tempo per una domanda. Chi vuole, non vedo nessuno. Chi vuole fare una domanda ad Anna? Ci sono tanti spunti, tra parentesi. Non vedo nessuno. Anna?
Yes.
Okay. Do you have any difference between north of nation and south of nation in epidemiology data or no?
Yes, we do. We have much more cases in the north of the country where the disease began. The disease began here in the north, and we have a lot more cases in the north than in the south. Yeah. Much more cases around Porto than around Lisbon. Yeah.
Okay.
Ci sono due domande, una di Savron e una di Pierri.
Ok, sì, li vedo. Allora, Luca, prego. Luca. Ok, forse no. Anna, Luca Pierri is asking, have you seen any association with Kawasaki on myocarditis?
Not yet. We have been reading about that, but not yet.
Ok, not yet. Ok, a questo punto io direi di ritornare a Benito, che dovrebbe essere pronto. Benito,
guardate una cosa, mentre parla Benito, per vedere le diapositive dovete entrare sulla mia finestra, perché sarò io a trasmetterle.
Ok,